Hi, my name is Shaylee Carter, and for my EDGE project, I became a certified nursing assistant. To become a certified nursing assistant, you need to pass both the written and practical exams of your state. For the state of Utah, in the practical exam, you have 4 skills that every individual who takes that exam needs to pass. That is the vitals. You have blood pressure, pulse, temperature, and they also put weight and height in there. Today I want to demonstrate how to get an accurate blood pressure and an accurate pulse. So we're going to begin with pulse. I have today Ben, who is helping me as I demonstrate this. So with pulse, the easiest place to find pulse on your test examiner will be the radial pulse, and if you can't find that, it'll be the apical pulse. So begin, we have the radial pulse. The radius is on this side, on the thumb side. You're going to take 2 fingers and gently press on that site. And then you will count for 30 seconds. And then multiply by 2. This will give beats per minute. And if you cannot, if you can't feel this, you will revert to apical pulse, which is using a stethoscope. You'll put the stethoscope in your ears, and then you would, in a clinical setting, go underneath the clothes and press against the apex of the heart. And then you would count each dub lub sound. So the heart makes 2 sounds per beat, dub and lub, and you'll count each 2 sounds. So dub lub 1, dub lub 2. But for demonstration purposes, I'll just go ahead and do this over the clothes. So you put the stethoscope in your ears, and then you will go on the left side of the heart, or of the chest, because that's where the heart is, and go on the apex of the heart. And you'll count dub lub 1, dub lub 2. And you'll do that for a full minute. Now, if your test examiner, for some reason, has a irregular pulse, you'll want to count for a full minute to make sure that you get each of those beats in. Moving on to blood pressure, you're going to take blood pressure with a sphygmomanometer or blood pressure cuff. So you're going to begin by putting the blood pressure cuff on the patient's arm, or your test examiner for this case, and you'll want to make sure that the artery mark is on that brachial artery, which runs inside that arm. Once you have it on, you will use the Velcro to securely fasten it on the arm. You do not want this to be moving around when you're doing blood pressure. Now, once it's on the arm, you will make sure that that valve is closed. So if you're holding it, most people hold it in their right hand, you'll roll it outward, and then you'll press it up. Then to release it, to release the pressure, you'll go toward yourself. Now, when we press the pump up, we'll want to go, here's the dial, we will want to make sure that the dial goes at least to 180. If your patient has higher blood pressure, you'll want to go above that. But for exam purposes, you'll want to at least go to 180. And then you'll release the air by releasing that valve by increments of 10 until you hear the first beat of that blood pressure. And that will be the number that you record as the systolic blood pressure, which is the number that goes on top. Now, you'll continue to hear that blood pressure until a certain point. At that certain point, that number is the diastolic blood pressure. And that's what you will record. The first beat that you hear over the last beat that you hear. So I'm going to go ahead and do it on Benjamin now. So I'm going to put the foot cuff on. Make sure that it's completely deflated when I do this. Make sure that artery is lined up. I'm going to put the stethoscope in my ears, obviously, so I can hear, and put the bell right under that artery mark. I'll make sure the valve is closed, and you also want to make sure that you're holding the bell with your index finger, not your thumb, for the same reason, because your thumb has a pulse and that could mess up what you're hearing. So we're going to pump up the pump to at least 180. And then slowly release by increments of 10. And then once you stop hearing it, you can just release all the way. So, Benjamin, your blood pressure was 128/76. So pretty good. Thank you so much for watching. Again, my name is Shaylee Carter, and I did my EDGE project on how I became a certified nursing assistant. I'm glad I was able to demonstrate these skills for you today, and see you next time.